everybody, how are you? Yeah, we are here yet again for another Facebook Live. We'll be talking about eczema in your breastfed baby. Now, do send in all your questions, any questions that you have. But while I'm waiting for your questions, let me share with you a little bit about my own children. Okay, as many of you know, I have 4 kids. My eldest son is already 21 years old. He was breastfed for maybe 1 day, total of maybe 1-2 bottles of milk of my own breast milk, and the rest of it he was water-fed from with formula. And then the second, third, and fourth baby I breastfed them. Now, out of my 4 kids, 2 of my children are affected by eczema, and the other 2 are okay. How is that so? And especially the one who is badly affected by eczema is also the breastfed one. So how do you explain that when a lot of research actually says that if you are breastfeeding, it actually helps with eczema. Now, breastfeeding doesn't mean that you will absolutely not get eczema. In fact, if one parent has eczema, there's a high chance that your baby will have eczema as well. And if both parents have eczema, then the risk is even higher. Okay, so in the case of my children, my husband has eczema. I don't. My husband has eczema, and well, the Russian roulette ends up 2 of my children with eczema. Compare the one who was breastfed, the number 3, she has eczema, and my number 1 who has eczema. The first boy, is still suffering from eczema now. He's 21 years old this year, and the third one is 18 this year, and she actually has not had a single flare-up for I think the past 5 years. Yeah. So why is that so? I think it does prove that if babies who are breastfed, the chances of getting eczema is actually lower than not breastfed. Yeah. And there are a lot of research that also shows that when a baby is breastfed with eczema parents, yes, they may still get eczema, yeah, but the flare-ups, the intensity of it, how serious it gets, may reduce. And a lot of times, depending on how serious it is, some mothers have to actually watch their diet. They actually have to consider how to manage it. Basically, if you understand what eczema is actually a flare-up of the skin. The skin has lost its ability to actually protect itself and to heal itself, and therefore the skin gets very red, gets very itchy and flaky and scaly, and a lot of time babies, especially small children, especially, they can't help but to scratch, and the more they scratch with their fingernails, the worse it gets. Okay, and there is actually no cure for eczema, we know that. So the best thing to do is actually prevention and management and prevention. Yeah. So what I do with my children is I give them a lot of fish oils. I make sure that they are always moisturized. You know, I see a lot of adults, especially adults, even have very bad eczema skin. Now my husband has very bad eczema skin. I keep telling him, no, you have to moisturize. He said, okay, I'll moisturize. Then he moisturizes. Then he forgets. He doesn't do it on a consistent basis, you know. So the recommendation is you have to moisturize at least twice a day. And when my husband do moisturize twice a day, he gets better. Yeah. So yeah, feel free to ask any question that you have. Yeah. Can spicy food cause eczema? It's very difficult to give you an answer today. Some babies yes, some babies no, some parents yes, some adults yes, some adults no. Yeah. So it's really highly dependent on that individual. Some people say don't take eggs, yeah, but other people take eggs and have serious eczema, but when they take eggs, it doesn't affect them. So it's very individual. You have to test and see. And if you know that particular food is a trigger for you, especially for yourself, then it may be a trigger for your baby as well. So I suggest that if you have a trigger yourself, spicy food is a trigger, try to avoid it. Now, if you're wondering where we are now in Gina's place, and we have babies here. We take care of, it's a confinement center, of course, so we have babies, and that's the baby, a hungry baby. Okay, going to be fed by mommy. Yeah. Okay. I've always tell parents, especially if they are pregnant, and you know you have a history of eczema. You know, once you have a family of eczema is in your family, is in your genes, you have to take extra precaution. Right? You already know that maybe your husband suffers from eczema, even yourself suffers from eczema, or your father-in-law, you say nobody in my family has eczema, but your father-in-law has eczema, and now you're pregnant. You should take some extra care with your pregnancy, okay? And also take some extra care after your baby is born, because your baby is at risk of getting the eczema, even though you're breastfeeding. Although breastfeeding may reduce the risk somewhat or reduce the flare-up somewhat, yeah. So what do you do if you you have the risk while being pregnant is make sure that you avoid, try not to drink too much milk. There are several research that actually suggest that drinking cow's milk, drinking formula maternal milk actually increases the risk of your baby getting eczema. Yeah. And at the same time, you can reduce your risk. I'm not saying absolutely it won't happen. Yeah, it's just reduce your risk of your baby getting eczema by taking good probiotics, and be on the lookout. It's a good time to actually search for products, because when it comes to eczema, as mentioned by a lot of doctors and a lot of scientists, actually there's no cure at the moment, but there's always prevention, there's always maintenance. Ensure that you get good baby skincare products. Yeah, there are many products that I can think of that is a no-no for babies. I won't mention it. If you want to know, you can PM me privately. I'll tell you which not to buy, but I'll rather tell you which one to get, yeah, later on. Yeah. So some people actually ask as well that they are breastfeeding and they continue to take milk. Actually, milk, right, is one of the risk factors of eczema. One of the triggers, the most common triggers: milk, peanuts, shellfish. Okay, but I've known of a baby whose eczema is triggered by grass. Yeah, their parents actually wanted to take photos of the baby and put a blanket over the grass, and then put the baby on the blanket, and then it triggered the eczema, and she started getting rash on her thighs, and then it got really bad, and then they went to see a doctor. And the baby at that time was only 1 year old. So he said for 1 whole year, no problems with eczema, and then suddenly it triggers, yeah, because eczema can affect especially babies, children, toddlers below 5 years old. So in the first few years especially, taking care of the baby's skin is actually very important. If you know family members who have history of eczema, you have to take extra precaution. Yeah. Okay. Now, do you have any questions? Okay. I recently had just 2 days, 1 day ago actually, I burned my finger. Okay, so I was trying to do something with the oven. I was trying to pick up food from the oven, and then I hit the top of the oven, where the heat plate is, and I burned my finger. And I didn't have any aloe vera with me, because we say burn fingers, you use aloe vera, right? So what I had with me was actually Dr. Butt's product, in my home, and I just grabbed hold of something called the Clear Rescue Soothing Lotion, because my husband is using this, my son is using this, right? So, and I didn't have anything, and I figured that if this worked for eczema, I'll use it on my own finger. And today, just 2 days, it's totally gone. There's no blister. It hurts and it smarts just a little bit. And I just want to take this opportunity to tell you that, hey, this is supposed to be for eczema, but it works for my burnt finger. Yeah. Okay. So what we are here to is, I know a lot of people actually ask me, what is a good skincare product? Okay, what's a good skincare product, especially if I do not know whether my baby is affected or not. The first most important skincare product is called breastfeeding. Okay, it means that if you do whatever it takes to breastfeed your baby, you are really giving your baby the best protection ever. Yeah, really, so many research papers, so many scientific research has found that breastfeeding actually will help your baby who has skin problem, and even those who don't. It will really make your baby's skin looks nice. And then after that, of course, when you bathe your baby, Yeah, I strongly recommend because I use it myself, I use it on my own children, and I use it in my confinement center. That's organics product for your baby. Yeah, for babies who are prone to eczema, even though your baby is born, there's a risk factor in the family. I really suggest that you start using the Dr. Butt's range of product. And what is in this range of product? Let me explain to you. We have this here, Easy Clear Rescue Soothing Cleanser. My husband swears by this. My husband loves this. Anyway, my husband is actually 54 years old. He still suffers from eczema. And when he used this for his hygiene routine, his bathing and all that stuff, he says it's really, really, really good. And yes, I actually see that he scratches a lot less now. Yeah. So with this soothing cleanser, and then we have this Easy Clear Rescue Soothing Lotion to be applied all over the body. So you can apply. It's very soothing lotion that you can apply all over your baby. And after that, if your baby has little spots that looks like reddish or scaly or especially dry, you can actually apply this Easy Clear Rescue Intensive Cream. Yeah. So my son actually used this for all those, he's still only 1 year old, he's still suffering. So using all this, does it cure them? It does give a tremendous amount of relief, especially if you have been suffering for so long. Yeah. I've also heard from friends, I've recommended this to a lot of friends. I've heard from friends that this really, really works, that tries so many things in the market and then it really, really works. And then I have a friend also who tried this and then she told me it's very, very expensive, so I just said just try it, it works for the baby. So she tried, she used it, she works for the baby got okay, the baby is clear, the skin is smooth, it's beautiful, and then she stopped using it, okay, for whatever reason she stopped using it. And then she tried other, the baby got a flare up. So she tried another product. I won't mention which one. She'll try another product and it didn't work. So then she came back to this one and this works. Why does this work? You know what? I'm not a scientist. I don't know why it works, but it works. But what I'm very sure of is that this product it's really natural. It has none of those nasties, has no steroids, has no additives, has no preservatives. It's really very, very natural ingredient and it's really, really very safe for your baby. Okay, I have no idea if I can eat it, but I actually think that if I accidentally lick my skin after using it, I'll be fine. You want to try? Okay, I'll do it. Okay, I just actually apply this cream on my finger here. So if I lick it, there's no taste. Okay, so I believe so you'll be fine. Okay, another thing that really caught my attention about this product is that it contains prebiotics. Yeah. You see, when a mother has been drinking a lot of milk during pregnancy and they tell me, oh, I've been drinking milk for the past 8-9 months, and now I've increased my baby's risk of getting eczema. It doesn't, maybe it's not absolute death sentence, yeah. I always tell the mother it's a good idea to take probiotics, yeah. Take a lot of probiotics to help your own self, your own immune system, and also the baby. At the same time, in order for good bacteria to flourish in your body, for good bacteria to flourish on your skin, yeah, good bacteria is also on your skin. Having prebiotics is actually food for the good bacteria. Okay? Therefore, what Dr. Butt's Easy Clear solution do for you, yeah? Actually a total solution of ensuring that your baby is, first of all, if there's a flare-up, to be rescued from the flare-ups. Okay, it's very, very itchy, very, very suffering, yeah, and then after that to restore. So it actually calms, it protects, all right, it repairs the skin. The prebiotics helping the good bacteria to grow. Okay, actually helps the self-healing power of your own body, of your own skin, to repair it, and then it prevents further future flare-ups. Yeah, and I've seen it happening with my husband and with my son, my 20-year-old son. Why do I do this and why do I speak about this? Because I have been looking for eczema solution the last 21 years actually. Because when you have a child who has eczema, not only the child suffers, mommy, daddy suffers too. And honestly, I've been suffering for the past 21 years. So every time I look at my son, every time I look at his skin, I feel bad. You know, and also because maybe because I didn't breastfeed him. I've learned to forgive myself. I've learned to move on, and now it's to look for solution. And I think, you know, Dr. Buzz is actually a really good solution. I read all their materials, and I've read some doctors who are really promoting and talking about Dr. Buzz, saying that how it helps the patient. I like that most of the people, especially my son and my husband, seems to find that it works. Yeah. Okay. Do you have any questions? Now, if you would like to give Dr. Buzz a try, okay, there's going to be a really special promo. Okay, so look out for the end of the video, and look out for the end of all our comments, yeah, and look for a promo code. Give it a try. I really believe you'll like this product. Okay. For other breastfeeding questions, we will be doing another Facebook Live soon. I think the next one that we'll be doing will be on how you can have clean pumps in your office. You know, a lot of people are talking about, do I have to sterilize my pump? How do I sterilize my pump without a sterilizer or without water? I have the perfect solution for you. How to sterilize your own hands, your table, and also your breasts and your pump parts. Okay, so wait for the next Buzz Organics Facebook Live. See you.